Laparoscopic mesh repair of incisional hernia. Laparoscopic mesh repair is an advanced surgical technique designed to address hernias with greater precision and minimal invasiveness compared to traditional open surgery. Advantages of laparoscopic mesh repair: 1. Minimally invasive approach. Smaller incisions minimize trauma to surrounding tissues, leading to less pain and quicker recovery. 2. Faster recovery. Patients usually have a shorter hospital stay and faster return to normal activities, compared to open surgery. 3. Reduced scarring. Minimal incisions result in less noticeable scarring, enhancing the cosmetic outcome. 4. Lower infection risk. The smaller incisions reduce the risk of postoperative infections, contributing to a smoother recovery process. Considerations: patient suitability. Not all hernias are suitable for laparoscopic mesh repair, and the decision depends on factors such as hernia size, location, and the patient's overall health. Potential risks: while complications are rare, they can include infection, bleeding, or a reaction to anesthesia. For more details, connect with Dr. Tulip's Tots at 988-613-9999.